Alright everyone, hello. I hope you can forgive the little purple dot that's like right there. There's something wrong with my camera. I'll have it figured out hopefully in the next couple of videos. I hope you can forgive the annoying purple dot right there as we do this next video. Thank you. What is peritoneal dialysis? Well, it's a type of dialysis that my dad is unfortunately on because he has polycystic kidney disease, which, goody, is hereditary. I have a 50-50% chance of having to deal with it in the future, which we won't know until I get older, unfortunately. Anyway, it is a type of bloodless dialysis. Now, there's a whole lot that comes with it, and there's no possible way I can remember all the technical terminology and words for it, so if it looks like I am reading off a piece of paper, it's because I am. Okay? And it's going to be a lot of technical medical mumbo jumbo. Basically, get through this part and you'll get through the rest of the whole video. Okay? So, ready? Buckle up. Here we go. What is peritoneal dialysis? It is a way to remove waste products from the blood when your kidneys can no longer do it adequately. A cleansing fluid that my dad uses is called dianyl. Dianyl is a peritoneal dialysis solution, which is sterile, non-pyrogenic solution in flexible containers for intraperitoneal administration only, which means don't drink this. The peritoneal dialysis solution contains no bacteriocystic or antimicrobial agents, which means it is sterile, and you have to stay sterile, or you can get a really nasty infection. Oh. Dianyl is a hyperosmolar solution, and it is a dextrose-based solution which patients with allergies to corn or corn products are at increased risk for allergic reactions, which may include anaphylactic shock. So if you're allergic to corn and you're in kidney failure, don't try this. Or try a different kind. There's all kinds of options out there. Talk with your doctor. Okay? Don't just take my word. Talk with your doctor, please. Okay. The plastic container, it's like a water balloon, which you guys will see in a little bit. It is made from polyvinyl chloride, which is PL146 plastic, whatever that means. Okay, mechanism of action. Dianyl is a hypertonic peritoneal dialysis solution containing dextrose, a monosaccharide. Yes, I probably said that wrong. Anyway, as the primary osmotic agent, an osmotic gradient must be created between the peritoneal membrane and the dialysis solution in order for ultrafiltration to occur. The hypertonic concentration of glucose in dianyl exerts an osmotic pressure against the peritoneal membrane, resulting in transcapillary ultrafiltration. It's kind of like when certain things go through a strainer and certain things don't. The solution goes into your abdominal cavity through something called a catheter. And yes, there is a surgical procedure, and it is kind of miserable, but in the long run, it is definitely worth it, as you will hear later from my dad. Anyway, it goes into your It goes into your abdomen, and the fluid goes into something called your peritoneal cavity, which is like a water balloon around all your organs, and it is separate from everything. And a little bit of the solution comes through into your body and pulls out the waste products from your blood. So it's pretty cool. As we talk more about it, I think you'll like it. It's pretty fascinating. Anyway, on with the medical mumbo jumbo. Like other peritoneal dialysis solutions, dianyl contains electrolytes to facilitate the correction of electrolyte abnormalities. Dianyl contains a buffer, a lactate, to help normalize acid-based abnormalities. Oh, now a little bit more technical stuff, and then we'll get to the good part. Glucose content in dianeal is expressed as dextrose monohydrate and is available in 3 concentrations: 1.5%, 2.5%, and 4.25%. Glucose is rapidly absorbed from the peritoneal cavity by diffusion and appears quickly in the circulation due to the high glucose concentration gradient between dianeal compared to blood capillary glucose levels. Absorption per unit time will be the highest at start of an exchange and decreases over time. The rate of glucose absorption will be dependent upon the transport characteristics of the patient's peritoneal membrane as determined by a peritoneal equilibrium test, also called a PET test. Glucose absorption will also depend upon the concentration of glucose used for the exchange and the length of the dwell. Glucose is metabolized by normal cellular pathways. Example, glucose. Yep, that's right. Okay. And provides a source of calories which may elevate blood glucose levels, which it can mess with. If you're on peritoneal dialysis, it means that the fact that you're on it can cause false readings in blood glucose tests. So, special card to carry around with that. If you're thinking of trying or looking into or even considering peritoneal dialysis, I encourage you to do so. Talk with your doctor, talk with your healthcare team. It's definitely something that is easier to live with if you don't mind the things that will be mentioned later. And one more thing about the peritoneal dialysis solution is it is the metabolism of lactate occurs in the liver and results in the generation of biocarbonate. Transport of other molecules will be dependent upon the molecular size of the solute and the concentration of the gradient, and the effective peritoneal surface area is described by the PET test. So, when I'm done talking in this little clip, I will include a picture of kind of what it looks like and how it works in the scientific level. I'll include a quick picture after that, after I'm done rambling, which I tend to do because I am looking into the eyeball of a camera. Anyway, let's get on with this. We will now go look at what all the supplies look like. Alright, if you watched the last part and you're still with us, go figure. I mean, that was a lot of technical stuff. Anyway, now we're on to the supplies part. What do you need for supplies for the peritoneal dialysis? Well, as we had mentioned earlier, they come in, dialysis solution comes in 3 different gradients. The yellow is 1.5% dextrose peritoneal dialysis solution, which is the lowest, and this is like taking up the whole hallway, which it's okay, we don't mind, it's part of our life. And in here we have greens, which usually takes up this whole wall, but my dad hasn't had a delivery in a little while, so he's not low, but we do need to do an order. And the green is, let's get to this, 2.5%, which is one of them. Now the highest that you can go that I currently know of is 7.5%. And these are smaller bags, and we'll explain more about that later. We have more supplies over here. Everything that says Baxter is part of this program. Oh. And in here we have the machine. You can see the tubing to last night's cassette, which has to be thrown out every night. Adorable supervisor, just for everyone who loves the puppy. And these are the integrated APD set with cassette, 3-prong. They come in different sizes for different patient needs. It's a lot of tubing, and once you get the hang of it, it's pretty easy to set up. I mean, I'm not on it, and I know how to set all this up. I was trained in it when he first started. Oh, this is the machine, It is a Home Choice Pro, and it's an automated PD system, which is automated peritoneal dialysis. This is basically his kidneys. This is basically what does it all. And here you have the spent cassette, which I can't figure out how to open this thing. And all the different channels go through here. You'll be able to have a chance to see this when it's set up. This is all clamped because this is a spent cassette from last night. And for like switching and changing, we have the pads, which I can't bend down to show you because it's really hard on my dizziness. Up here we have end caps, which he has to change every time he opens and closes his catheter because he has to be completely sterile. It's called a mini cap, and it comes with povidone and iodine solution, which it's single use only, and it comes with an expiration date, and you cannot, if it's even slightly expired, do not use it. And you'll hear all about that. Every night he has to take his temperature and weigh himself, and when he's changing, when he is changing caps or hooking up, he has to use one of these masks just so everything's sterile, there's no germs or anything, just so that we can avoid the potential for the nasty infection as mentioned earlier. Now, something you may ask is, okay, all this stuff goes into your body, well, how does it come out? I mean, don't you gain a lot of weight and everything? Well, there is something called a dwell time, and there's a certain amount of time where the solution will dwell in your abdomen, and once that is over, the machine will then have it come all the way out of, it'll come out of your body, and my dad lets the last of it drain into the bathtub, which is pretty economical, and you don't have to flush the toilet all the time, but you do have to watch your drains because it is a dextrose solution. It can make it kind of sticky and gunky, and just, it can plug your drain. So make sure you keep that clean. And over here we have more of the dialysis solution, and this is the 4.25%. Now, my dad uses all the 3 different gradients plus the purples, which is 7.5%. There's a lot of medical mumbo jumbo, which I do not have technical terms, and which, in short, my dad uses, he can explain more about that later, which I will leave up to him because I don't know everything. I know enough to, if he's in an emergency situation, I can help him with his dialysis and help him hook up, because he cannot go more than 3 days without it, or he will become septic. And even then, he's really miserable. He has to do blood pressure, weight, and temperature every day. And check all that every day. Make sure that's all good. Now, what happens if there's a power outage? What happens if you can't... What happens if your machine doesn't work and you don't have a generator or something like that? Well, there is a way to manually do that. And this is a scale that's used. And basically what happens if you can't get to electricity, or if there's something, some other reason, there's something called a manual exchange, which is where you hook one bag up full of solution. You have one bag down on the floor, and you clamp the bag of solution, unclamp the bag to the floor, and let the solution flow out into the waste bag. And then when that's done, you unclamp the tube up to the bag full of solution, let that empty into your abdomen, and then it does the dwell time, and then you, in a few hours, you do it again. And yeah, that is basically what I can think of at the moment. We are going to now pause the video and wait until my dad gets back, and he can explain more about it. So something people might wonder is, when you're hooked up to the machine, how do you go out and get bottles of water and stuff? How do you use the bathroom? Well, my dad's bed is right here and his bathroom is right there, so that's not a problem. And for things like water bottles and stuff, we have Ella here, which, Ella, ready? Water bottle, please. Go on. Water bottle, please. Good girl. Go get a water bottle, please. Wait for it. Good girl. Thank you. Which we have water bottles in a designated area, and I recently just started training Ella on how to bring us a water bottle no matter where we are in the house, because I have dehydration problems, and a lot of my dad's meds make him have dry mouth and stuff. Which she is my service dog for me, but she has a few little tasks to help Dad with stuff just because she has that ability and she is very intelligent. And she really enjoys it, don't you, pup? Hi, Ella. Hi. You enjoy that. You enjoy your jobs. Yeah. Okay, now we're going to go and wait for Dad to get home. He's here! It's Dad! The one who's actually on dialysis.
Yep, I'm on peritoneal dialysis. What is that? Well, think about a reverse osmosis water filter. So, this is the sterile water that you heard about earlier. And this creates a osmotic imbalance between the peritoneal membrane on one side and the other. This is like a negative charge or a positive charge, I don't remember which. And the waste products in my body are the opposite charge. As a result, this stuff is dwelling in me for about an hour and a quarter per dwell. It puts 2,000 milliliters in me, or think about a 2-liter water bottle. That's per cycle. Now, some people get more, some people get less. But for me, a dwell is about this much. That's 2,000 milliliters, or 2 liters. So what happens is it dwells, it's pulling the toxins through the membrane, holding them, and then the cycler pumps it down the drain. And then it refills, and it does that 4 or 5 times a night. Now, what this little bag is, this is the last bag that goes in me. This one is extra nil. It's not sugar base, it's cornstarch base. And the idea is, this sits in me all day long, and I do not reabsorb it. Because what happens is, if this goes to equilibrium with my body, this can be reabsorbed with the waste products. We don't want that. So the last fill is this one. And this is, like I said, cornstarch based. And I'll show you the setup in a minute.
Now,
one of the things about doing this when you're handling this stuff, when you're getting ready to unhook or hook up to the machine, you must be aseptic. Not sterile. Sterile's okay, but it's really hard to achieve sterile in the residential setting. But you can achieve aseptic with just common sense, good hygiene, and a mask, which you'll get to see in a couple minutes. So, at this point, I'm going to set it all up, but I'm going to let you see the catheter first. I keep mine taped because the PD belt they give me drove me nuts. That's where it goes in. You want to take good care of this spot right here. No tugging on the catheter. Anyway, that's the catheter. It gets, checked every month. So, there you go. Ha. I'm a little fat right now because of a drug they tried me on. Didn't agree with me. So, yeah, that's getting corrected. Thursday. Anyway, come with me into the bathroom. So, aseptic is hot water, soap, and you wash your hands really well. After being on dialysis for so long, my hands are no longer like a brick, rough and calloused. Pat dry with they say a sterile towel. Again, this is residential. We're talking aseptic. Then the mask. Okay. Tear the bags open. This is 6,000 milliliters, or 6 liters.
2
Another
liters.
6 liters.
2 liters?
Huh?
2 liters, right?
No, this is 6.
Ah, okay.
6,000 milliliters.
The box is just a good place to put the plastic and stuff until we can take care of it later.
Yep. So this is a 2,000 liter bag of extra meal. This is the cornstarch based one. This one sits in me all day long. It doesn't come out until tomorrow. It's the last one to go in. It's the first one to come out. Then the next thing I have to do is weigh myself.
I'll be nice and not show your weight. But see, he's on the scale. Your book is over here.
Okay. I have a book, a daily journal. Today is the 18th. 10, 18, 17, 246, 0. Turn the machine on. It's self-testing. I enter my weight. Open the cassette. Now this is why I washed my hands. This is the neat thing about this is a sealed system, but you still want to have aseptic hands. I cannot contaminate through this if everything goes well. This is the drain line. This goes to the drain. So I close all the clamps. I hit go. I unroll this one because right now the machine is self-testing. It's checking everything, checking the integrity of the cassette and all that. Just toss it in the shower there. I wait a few minutes. We can pause it. So the machine's telling me connect the bags. So first one here is the red one. This one goes to the heated bag. The heater bag is on top of the machine. Remember, aseptic, I've already washed them. Face mask on. Connect bag 1. Connect bag 2. I pre-loosen these caps because they can be really on there. So I'm holding the stem here, and no chance of getting it dirty or contaminating it. Again, I loosened it, but I didn't remove it. Well, okay, there we go. Pull, pull, connect. The next thing to do is open the clamp on the patient line, break the frangibles, open clamp, break frangibles, open clamp, break frangibles. Hit go. So anyway, I was priming it the last time you saw me, hooking up the bags and all that. Well, it's now set up. It's ready to go. It's got the heated bag heated because it doesn't want to pump cold water into me. So it heats it to about 100 degrees roughly. And you don't really notice it going in that way. So it's ready to go. It's waiting for me to do my thing. If you look at the machine down below it, they're hanging down the hose. That's about, go ahead and get a picture of the coil there. That's about 14 to 16 feet of hose. Once I hook up, I can go down the hallway almost all the way to the end. Bathroom, whatever, other bedroom. Looks pretty good. So for that, it's all good to go. I do my PD at night. For the most part, I don't notice it. I don't feel it. I'm not aware of it. For the most part. Some days I am, you know, for whatever reason. I don't know if the planetary alignment or something had to do with it. I kind of feel it when it drains me. The machine thinks, oh, it needs more juice than 2,000 milliliters. Yeah, that's not fun. Anyway, don't last long. A couple of minutes of that. So, well, I guess I'm going to do my blood pressure now. Grab the book. I got my cuff pre-sized. So I took my blood pressure. I'm recording my blood pressure and pulse. And then the other stuff, I tend to make notes, like I did 2 green today and 1 purple. So, yep. Put this
Our little supervisor, of course.
over here. Yeah, temperature.
Oral temperature, of course.
Yeah, I'm normal. Okay. Done with my book for tonight. Now in the morning, I got 4 data sets that I need to record from here, and I log them in the book. And that pretty much covers the machine until I hook up, which I probably won't go into all that, but it's just a pretty simple. Hook it to here, and that's about it. So over there on top of the bed,
Go.
this is NetPro. That's because when you're on PD, you lose a lot of protein. So this is a protein supplement. It adds more protein to the system. This, for me, this one is called Forazinol. It's a lithium-based phosphorus binder. Yeah, I gotta eat one of these with most meals. Fortunately, it's chewable, because I ain't swallowing that thing. I've been told they taste horrible. They don't. This is the 4th binder they've tried on me. The last 3 did not agree with me. So, yeah, bottoms up. Meh.
There. Now you're on.
Because this has phosphorus in it. Oh, somewhere in here, I forget where it is. Phosphorus. 170 milligrams. I'm going to pop one of these puppies and chew it. Yeah. So, questions and answers.
One moment, we were going to take a break from this. This one told me it was time to sit down because my heart rate was going up and I didn't want to deal with a sudden dizzy spell. So I'm now sitting down and she is making sure that I am doing what I'm supposed to. And back to Dad. So, I have some questions here and just simple things. Number 1, do you think it's worth being on peritoneal dialysis?
Oh yeah. I've done peritoneal. I've done hemo. I would rather be on peritoneal any day of the week. You do PD every day. You do hemo 3 times a week. Hemo leaves you feeling like you just got done being in a bar fight for an hour straight without a break. And you ain't got a bruise on you, but you sure feel like you've been fighting it. It just kicks your butt. Yeah. I would get done with hemo, go to the motel room, and sit there, lay on the bed, and count the divots in the ceiling. I couldn't do anything else. I was too whipped. So anyway, next question.
What things can you do on peritoneal dialysis versus hemodialysis?
Hemo, you don't do much of nothing. You get around through the days, and on the days you don't do hemo, you can pretty much do normal stuff. There's a few things you can't do, like, you got to take care of your catheter, your access points, or whatever. With PD, you got to take care of your catheter. But as far as what I can and can't do, I pretty much do whatever I want. I built a pickup truck this summer from the frame up. I couldn't have done that on hemo. It would have taken me pretty much all summer and all fall. So, yeah, I can pretty much do whatever I want on PD. I can't lay over fenders. I cannot be rolling around in the mud like I used to. And I gotta be mindful of the fact that I have about a foot of plastic running through my belly just under the skin. Yeah, you'll notice it when you mess up. Trust me. It lets you know.
What is the most easy aspect of being on peritoneal dialysis?
It's easier on your system. It's the closest thing we've got right now to natural kidney function is PD. There's no blood involved. There's no filtering the blood. All that is done inside the belly.
What is the hardest thing about being on peritoneal dialysis?
Remembering to be totally aseptic when handling the equipment and hooking up and unhooking.
What about restless legs?
I got restless legs. It's not because I'm on dialysis. It's other issues here. I've dealt with that off and on throughout my life, but this time it's a little more severe.
What is something you think someone thinking about trying should know about peritoneal dialysis or PD?
Talk with your doctor, do your homework, get on the internet, find the information, learn understand it, and just remember, aseptic. I can't tell you enough, aseptic. Aseptic. You ain't gotta be sterile, but you gotta be aseptic. Which means clean hands, the mask, the hands, clean equipment. You want to keep your room clean and where your equipment is. It doesn't have to be spotlessly tidy. It just has to be clean, as in not unsanitary.
Yeah.
And what else?
Is there anything extra you'd like to tell someone that might be thinking about trying it, or something that someone might not even think about asking?
Not really. I think I've covered pretty much everything. Just, it's think reverse osmosis. Some people have to run around with a dwell in their belly all day. Some people do a midday exchange. Most people on PD are also using a CPAP or an MPAP or whatever. I don't know if that has to do with the PD or not. I've noticed people I've spoke with who are on PD have a CPAP. And not all of them are heavy and overweight. That's just what it is. Maybe sleeping with that water in your belly makes it so you want to snore more. I don't know. I don't get it. But I sleep better with a CPAP.
Something we almost forgot to include in this video is, how do you travel while you're on peritoneal dialysis? Well, we have the answer for that too.
So, every month I have to travel from a town in southeast Alaska called Wrangell to the capital city in southeast Alaska of Juneau. I have to put my machine in the case here.
You can open it up and show them if you want.
Yeah, I can. The machine kind of fits in there all nice and snug. And as you can see, it's got an Alaska Airlines Fragile tag all over it. And so the machine goes in here. Total weight is about 49 pounds. A box of solution goes with me for an overnight visit. Total weight of 12 liters of sugar water, which is approximately 47 pounds. And then I toss in a 2-liter bottle of water on top of that. That all goes in this case here. Along with my cassette, I take 2 cassettes, 2 extension hoses, extra caps, and a mask or 2. And the reason I take a couple of extras, I have had 2 instances where I've installed the cassette and it was bad. The machine rejected it. So that one comes out and I throw in a new one. So I like to have a spare with me, because if I'm in Juneau and it's 9 o'clock at night, I'm not going to do PD if I don't have a spare cassette. So anyway, that pretty much sums up the travel. And then there's one more thing that it's going to sound kind of weird, but avoid a comfort height toilet. The mechanics of it and the way it puts your body is wrong for complete bowel emptying. And with PD, that is critical. So You can listen to the slick salesman at the store, at Home Depot or wherever, telling you how good they are. Or you can take it from somebody who's lived it, researched it, and figured out what the problems were. It's better to get a handle on the wall to pull yourself up with than to have a comfort height toilet. Other than that, that pretty much covers it.
One thing that is something that happens when you have to travel on peritoneal dialysis is you get 1 box per day, per night. So there is a hand cart right behind you, Dad. And
oh yeah, that's if I got to take more than 1 day with me. I can take a couple of extra boxes. I can travel by myself and take 3 days worth of supplies. And that's a lot of trouble, but I can manage it. I've done it. If you're going to go on an extended vacation, like let's say I want to go from Southeast Alaska back to Indiana. I can call Baxter and give them an address of where I'm going to be in Indiana, and they will deliver however many days of supplies I'm going to be there, and it will be there waiting for me when I get there. So if I'm going to be at my cousin's house for a week, I just give them his address in Hammond, and there we go. It's no problem. It'll be delivered before I get there.
And something you might wonder is, doesn't the airline charge for all of this?
This is medical supply. They don't charge for it. As a rule, they do not charge. And I do not take advantage of it and take more than I need per trip. I try to be frugal with that and not abuse it. So when I leave town with 3 boxes of supplies and the cycler and a backpack for carry-on for my clothes and meds, that's all I take. I don't take a whole bunch of stuff because the medical supplies go free. Other luggage, I'm allowed 2 bags in Alaska for free, and that's it. I don't want to try and abuse the system.
Go.
Another thing that I remembered is this is what we call a measuring bottle. It's a water bottle, juice bottle, milk bottle, whatever you want to put in it. And there are some people on dialysis who have no kidneys or no kidney function. What they have to do is they have to measure input every day. And they're allowed so much, and that's it. So keep in mind, for some peritoneal dialysis patients, this becomes a part of your life. I've got my right kidney is still with me. It's around 8 pounds estimated, and it still has some function in it. Wow, am I lucky. Now, my left kidney was removed back in February.
And I will include a picture of that at the end of this clip for those of you that are weirdly interested.
It was 11 pounds when they took it out. Now think about that. My left kidney was 11 pounds. Most babies weigh 8. So yeah, I had a really huge belly. Too many women were walking up to me, rubbing my belly and asking me when I'm due. They didn't realize what was going on until I told them. Then they felt bad. And I would just laugh, and it was all good. But yeah, for some people, when you'd have no kidneys or no kidney function, this is what you gotta do every day. You want to measure in and out. It's really good that you do that. So yeah, I can't think of anything else at the moment. I don't need this yet. I'm not needing it yet. I pretty much keep myself, I'm pretty good at, managing my intake. Okay, I hope this video session helps you. I hope it answers your questions, and I hope you have a great day. And don't be afraid.
You have the gist of it. You know what happens, where it happens, and why it happens. You know where all the stuff comes from. Now, one last question you might have is, what happens to all that cardboard and the plastic and all the medical waste? Because there sure is a lot of it generated. Well, to answer your question, this is what happens to it. We put it all out on the deck until we can process it later in the week and put it in the proper areas. The cardboard is recyclable, some of the plastic is, but not all of it. And you can hear the kitty meowing somewhere. But yeah, this is where we put the plastic and waste. Most of it's put here until about the end of the week, where we can process it and put it where it goes. And I don't think there is much else to talk about. I mean, the deck's covered, so we don't have to worry about all the boxes mildewing in this wonderful Wrangell weather. And, yep. If that doesn't answer the question, what is peritoneal dialysis, I think you might need a little bit more help than I can give you. Well, with that, it is about 10 o'clock p.m. here, so I'm going to say goodnight, and thank you for watching. And remember, please like and subscribe. The more people that subscribe, the more videos I will make. Thanks. Bye.